Hello everybody, welcome to the next episode. Today I'm going to be going over porcelain laminates, or as most people know them, veneers. Now, what is the difference between a veneer, or a porcelain laminate, and a crown? The only place you can use the laminates are on the front portion or the anterior part of your teeth. And they're not as big as crown, and they're not as strong or protective as crowns. Now, normally a crown engulfs the entire tooth, but there are specific situations where you need a crown as opposed to getting a laminate. Laminates are normally mostly used for aesthetic reasons, and also in situations like, for example, if you have bruxism, if you grind your teeth, especially in the front where they're withered away, but there's not that much loss on the enamel where you might need a crown. Sometimes you could get a laminate and you would be perfectly fine. Now, porcelain laminates are not as strong as, like I said before, they're not as strong as crowns. The reason why is because they only engulf the front part of your teeth. And it does not mean, though, that you can't use them for daily use. Now, it's the same thing as crowns where, don't bite hard things. Don't chew ice. Definitely don't use them to open up a bottle of beer. Don't chew on bone and things like that. The porcelain laminates are the exact same thing. So you want to take care of them just as much as you want to take care of your crowns. Now, one of the things that can happen when you do have a porcelain laminate, and it's not for everybody, this is in some occasions, is that you do get sensitivity on the tooth. The reason why is because when they shave down the enamel, and if you already have a tooth that might be thinner than what it normally is, it might dig more into the deeper parts of the tooth, and that can cause sensitivity, because that area is not as strong as a part that's out there, as the enamel that's outside of your tooth. So it doesn't mean that it doesn't go away. It does go away with time, but it doesn't. When I say with time, I'm not talking about a week. It can take a week, but it could also take a month. It could take 2 months. It can take 4 months. It can take 6 months. It all depends on every person. Everybody is specific and special with their with sensitivity to pain, and two, with the situation that they have with their teeth. So what you want to do, or when it does happen, and your dentist will tell you the same, is you want to use toothpaste. You also want to use mouthwashes that help with strengthening the enamel on your tooth, so that way with time those parts of your teeth start building up the strength and getting rid of the sensitivity that you will have when you get the porcelain laminates done. Other benefits to getting porcelain laminates is that it's not only for an aesthetic purpose, like I said. The other one, for example, is if you do have situations where whitening is not going to help you. So in which are very special situations. But if you have, for example, teeth that are of a different shade, because you might have had a lot of fluoride when you were younger, which caused your teeth to get into a darker color, a yellowish color. Another thing too is if you have stain in your teeth that are not involved with your teeth just getting dirty over time, and the enamel filling up the pocket holes on the crown with the enamel filling up with dirt. So in situations like those, you do want to get a porcelain laminate to change it, and then at the same time, normally when you do get one, you tend to get more than one in the area. The reason why also is because you want your teeth to match. So for the most part, when a person gets a porcelain laminate, they normally will either get all 6, sometimes they'll get 2, sometimes they'll get 4, but it's very common for you to get more than one. Now there are special situations where a person might get just one, and it could be maybe that a tooth might have been smaller than the rest for some reason, or maybe they had a baby tooth and the adult tooth just never came out. In those cases, you could use a porcelain veneer or even a crown. It depends. That's something that you will want to leave up to your dentist, and your dentist will suggest to you what would be the best option. That's going to be all for today. And as always, flourish and prosper.